Okay, so the very first thing, I mean, I just kind of wanted to start off with, like, from my side, I'm looking at three things when it comes to athletes. You're looking at the strength aspect, so the kind of the ladies lifting in the background, the movement aspect, and then the conditioning aspect. So that's my thinking of how can we integrate all three things into an athlete's program. Oh, I think I'm getting, how do I do this?
Yeah, oh, I got it.
You got it? Okay. Okay, so yeah, those are the three things that I'm looking at as far as trying to give some guidelines to the athletes: is the strength aspect, speed, and the strength and power, the conditioning, and then the movement aspect. So the kind of constraints that we're looking at are going to be the social distancing guidelines. Again, these things can change. They can be more restrictive or probably more relaxed down the road. Who knows? But these are things that I'm considering when I'm trying to give athletes some feedback. Keeping it clean. We're doing things mainly outdoors. They're going to be limited with equipment wise. They're going to probably be wearing a face mask. They're going to be missing the coach's eye unless they're doing it via Zoom, which is going to be a little bit of a challenge. And then the accountability is not going to be there because us as coaches are not going to be there the entire time. And then how much time these athletes are going to have. So let's really quick start with the movement aspect. These are the things that me as a strength and conditioning performance coach, what I'm looking for is deceleration mechanics. And the key thing with this, I see a lot of kids, they'll implement this, but they're always going in a straight line. So they're always going front and back. They're never going side to side. So one of the things with deceleration, unless you're running track and field, you should be implementing different planes of motion. So we're going side to side drills, forward and back drills. We're doing closed chains. So these are like cone drills. So they go to orange cone, to yellow cone, to black cone, and so on. And then we have some open chain movements where they're, you know, whether it's like a parent that maybe is out there with them and they're giving them a left-right command, and they're having to react to some type of stimulus. And then going back to jump and landing mechanics, again, same concept as we want to go multi-directional. We're not just looking for vertical jumps. We're going side-to-side jumps, one leg, two leg, and then lastly is that eccentric component. Again, I always try to use analogy is you wouldn't get on an airplane if the pilot didn't know how to land. So athletes always, they're focused more on areas that when it comes to movement, what I'm looking for to kind of drill with the athletes, parents, and sport coaches. Okay, so now kind of why, let me move this over a little bit. So why would this work in this kind of time is it can be implemented while social distancing. So if you have a group of kids or just kids are doing it on their own, it doesn't require a lot of equipment. It just needs some open space. It's very easy to progress. You can tell them to do 5 sets of whatever drill, and then the next week, 6, 7, and so on. I like to start from a low volume, especially now, and then gradually increase the sets, repetitions, and things like that. And then lastly, it's going to be just checking your ego. I think it's really important to get the kids to understand that this is about skill development. It's not just about competition, especially early on. That way they're not progressing too fast and risking an injury. So these are just some drills that I found online, really basic. So if parents are watching right now, you can literally just go on YouTube and type in deceleration drills, and you're going to see things like this. You got 3 or 4 cones, the athlete sprints, and then he stops at 1 cone, breaks down, and so on. So these are really easy to, if they have it on their phone, they can literally look at the video and then go and implement this out on the field or on the track and things like that. Okay. How do I get to the next one? Okay, so then change of direction. Kind of, this is more of the close chains. So you're just going, you're following a certain pattern. So you're going side to side. There's no reaction to it until she's at the end and she's catching a ball. But this is teaching good body mechanics, teaching shin angles. It doesn't have to be super complex, but the key thing I want parents and sport coaches to see is different directions, multi-directional. It's not just forward and back, which is what you're going to see a lot of kids doing, just going forward and back, forward and back. So change it up. I mean, there's no really rules to it. The key is to get them exposed to different types of movements. Okay, and then The difference between that versus a reactive component. So this person here could be a parent, it could be a sibling, it could be a coach. As long as you're keeping the distance, and it's going to be okay. So you have one athlete that's going to sprint, and then he's going to have to react to that stimulus. So it's either left or right, and then they got to react. And I think these are the drills that eventually are going to be much more kind of sport specific to what kids need to be doing versus just going, most people would do a ladder drill or just, basic cone drills. I think we got to progress that and throw in a reaction component. Okay. And then these are just jumps. I don't want to kind of go into these, but these are just jumps and I mean, are we good with time, Marco?
Yeah, you're good.
Okay. So if you, again, you can do this on a park bench. It doesn't have to be a fancy box like this. Just find a park bench where you're stepping off, you're landing, you're absorbing, and then you're jumping off. So this is a depth drop or depth jump. And then you have a different variety here. You lower the box, and now you're stepping, and then you're quickly rebounding off the ground. So you're not actually squatting into it. It's a very, very quick land and get up. So again, you don't need a box. So you can literally just find a bench at the park and do these drills. And then these are, again, going back to the bilateral, unilateral, we have to make sure we're doing single leg stuff. So really basic drills, hopping on one leg, okay? Hopping on one leg, now you're moving forward. And then hopping on one leg where you're going side to side. Okay, so again, the concept is do both two-legged jumps, single-legged jumps, different directions, have them jump and twist in the air and everything you can think of, and just get them exposed to different types of stimulus and different types of positions that they're going to be landing in. Oop. Okay, now we're moving on to kind of strength and power. Here are some kind of areas of importance that I'm looking at is eccentric loading. Okay, so we want to make sure that we're training this aspect. It's not just the concentric movements. This is just going to help with reducing injuries. As you can tell, this person got pretty creative with some Nordic curls. He found something that he stuck his feet underneath, and he's lowering himself for the hamstrings, glutes. Exercises in all planes of motion. A lot of times people are just getting stuck in one plane of motion. So make sure you're going front, back, side to side, and some rotational exercises. Posterior chain emphasis. You got the calves, hamstrings, glutes, low back, upper back. Those are areas that I'm definitely going to pay more attention to because most kids, I'm assuming, they're out home doing tons of push-ups. I'm sure they're doing push-ups and sit-ups, push-ups, sit-ups, and squats, but they're not getting any posterior chain work. So I know that going in. So I'm probably going to program, like a 2-to-1 backside to front side ratio. Get some core development. That could be planks. Again, they're probably most of the athletes I see on Instagram, they're doing tons of sit-ups, but some planks, some pull-up presses, and things like that. And then rate of force development. We start with strength, we move to power, and then we move to speed. Oh. Okay, so one thing a lot of people forget when it comes to strength and power, they only think of the weight room. One of the best kind of power exercises, probably in my opinion, probably the best, most specific power exercise is sprinting. A lot of times people forget that sprinting is the highest velocity type of movement that you're going to be able to do. You can't mimic anything in the weight room as far as the speed and the velocity component. So sprinting is a great way to develop strength and power. It's got a really high neural demand, high rate of force development, extremely simple to manipulate. You can go a little further distance. You can go on a hill. You can add some type of band resistance, and then you can change the surfaces as well. And it's very practical to COVID-19. You can pretty much do this anywhere. Medicine ball is another great tool to have if you're a parent. They're very cheap. Might be a little tough to get them now just because they're probably low on inventory. But if you can get your hands on them, these are easy to wipe down, to clean. If you're using it with multiple people, you can have people safely spread apart. They teach that kinetic chain from the ground all the way up into the arms and the hands into the ball. They're ballistic, very, very simple to teach. You can literally just show a video to an athlete and they can visually see the execution and they can almost do it to a T. So, and it's very practical to these times. Now, when it comes to kind of body weight, so I think a lot of kids are using a lot of body weight stuff right now, which is great. But at some point, you don't want kids just to be doing 50 reps, 100 reps, and just getting crazy with the volume. So I guess it's teaching these kids how to progress body weight exercises. And that just means moving from bilateral to unilateral movements, holding certain positions with some ISOs, adding tempo. So they're, going down for 5 seconds, exploding up for 1, and they're maybe even holding at the bottom of a squat. You can add some speed to the movement. You can increase ranges of motion, shorter rest periods. And again, practical. You can see this woman right here is just on a bench at a park. So easy to do anywhere. Just have to kind of coach the athlete how to make things a little bit more challenging. And then lastly is going to be energy system development. One of the things I think I saw something on Facebook that a parent posted that the kids have, they returned back. I think it was a female soccer high school program. And their workout was literally like 400 squats, 300 push-ups, 100, meter sprints, do that 5 rounds. And this is coming from 4 months of not working out. And I guess his daughter came home and they had to take her to the hospital. She was experiencing super, super high amounts of pain. And luckily she was okay. But it's just things like that where we have to progress energy system development from low to high intensities, low to high volumes. When the kids get back, we have to teach them that, we have until December. It's not we just got to go, ham from day one. It's a general progression. I'm a firm believer of a general preparation phase where we're building the aerobic capacity, kind of the gas tank of the athlete. And then we're moving into a bigger engine and doing more short, high intensity sprints. And then always keep in mind the set principle is don't try to build everything at once. Pick a goal, pick an adaptation, train it, let it adapt, and then you can move on from that. So you can spend, 2 to 4 weeks on a specific goal and then move on from that. And if you see these photos, again, practical, find a hill, you can sprint up the hill. If you have a truck or a car, you can literally just push this and it basically turns it into a prowler or a sled. Okay, we're almost done here. And then again, just kind of put some more examples of how kids can get out, get a jump rope, $5-10. You can find some stairs either at your high school, college, or somewhere, or do some sand sprints. It doesn't even have to be on a hill. It could just be at the beach. But I think now is a great time to change up the surfaces. Don't always have them, running on a certain pavement or at the track. Let them go to the sand and take a little ease off the joints. Have them go in the pool if they have access to that. But again, it's just thinking outside the box and giving kids options, because not everyone lives by the beach, but they might have a college that they can find some stairs with. And then here's a chart, as the last slide. It just shows different methods that I use as far as conditioning. So again, we have a cardiac output method. So this is kind of longer, low duration, low intensity movements. And then we have tempos, high resistance, ALAC. So this just basically tells you how do we do it, what kinds of exercises, frequency, progress, and so on. So these are just things, there are just so many options that it doesn't have to be just go out for a run for kids. And that's it for my end. If you guys have any questions, either the people on the webinar or anyone tuning in.
Yeah. I think there was a question on there as far as face masks. Types of face masks being able to utilize to return to play. Do you guys have any experience with any of those that you guys might recommend?
Go ahead, Jerry.
So I just bought and I'm sure people have seen the new Under Armour one. It's made to kind of be for athletes. So I've been using it for about a week now. I still find like when I do hills, I still got to remove it. It's still a little tough to breathe. But I do like the fitting is really nice. It gives a little bit more cushion between the mouth and the face guard. So I don't know if I would recommend it for $30, but I like the comfort. To me, it's more about it doesn't pull on my ears. But high intensity stuff, I still have to move it down. But as soon as I'm around anyone, I just put it back up.
For me, I found that the neck gaiter works well. And as long as the fabric is technical, because when you sweat and the moisture builds in and it's hard to breathe. So I think I really recommend just kind of experimenting depending on the activity, how fit the person is condition-wise, but you definitely still, like what Jerry said, have to remove the mask for breathing. And I know CIF suggested that all teams, when they come back to practice, they have to wear a mask. So I would suggest maybe having the players experiment now, so they're not gasping for air when they're on the field during practice. It's going to, might be really hot for them. So they need to prep for that now, start experimenting now.
Yeah, good point.
There was another question on here. What types of sprint intervals do you suggest, time and distance?
So, I mean, typically if I'm going to have athletes sprint, I'm not letting them sprint past maybe 10 seconds. And the reason is because I want high neural intent. I want them to really, really push themselves. It's not a conditioning session. I think one of the biggest misnomers is like sprint and speed power work, you have to end up sweaty and super tired. And it's the complete opposite. You should have them sprint 8 to 10 seconds. So they're staying in that alactic kind of energy system, and then have them walk back, recover. I usually tell kind of coaches, parents, and athletes, like, you're probably going about 8-to-1, 10-to-1 ratio of rest to work. So if you sprint for, 8 seconds, you're resting for a minimum of about 80 seconds. So almost about a minute and a half, they're walking back, and it's all because of the intent. As you just send them, it doesn't mean it's a bad workout. It just means if you're trying to work the power and speed component, then you got to keep them relatively short. So 8 to 10 seconds, sometimes even 6 seconds. But I wouldn't, if you're doing a sprint session, I wouldn't send them past that. You're looking at anywhere from 8 to 12 repetitions with adequate rest periods. And you can do, a little bit of core work in between the rest periods. So you can have some active rest if you want. But I'm typically no more than about 10 seconds of a high effort sprint. And you can, what you can tell if they're getting tired is, like, if you're a parent and you're there with them, time them and see how long it takes them to cover a certain distance. So let's just say, 60 yards, time them. If it takes them 6 seconds and by the 8th rep, they're taking 10 seconds, like, they're getting fatigued because they're not, they're plus or minus about now 4 seconds. So now maybe give them more rest period or shorten up the distance. But the goal should be high effort, high neural demand.
Dr. Nima agreed with you on the Under Armour mask on there. I saw it. Actually, I was thinking about buying it for my daughter and for myself. I may go ahead and just jump on there and get it done. Dr. Nima, there's a question on there, the chat, regarding chronic issues or injuries or concerns. I know that's kind of, I think, my biggest concern. Well, good. Do you want to take that one?
Yeah, we've talked about this quite a bit.
I know.
So, it all obviously depends on what part of the body we're talking about. But I always split up chronic injuries. Chronic injuries generally tend to be more non-operative injuries, right? And we see that a lot more times. We're dealing with hammies, ankle sprains, things like that. A lot less often we're dealing with something like an acute ACL. Most commonly, what I notice, and it kind of goes back to Jerry's thought, is I really believe it's actually has so much to do with the posterior chain. The biggest problem I notice in athletes, I test for example, let's use ACLs. I test every person that comes in who tears their ACL. I test their non-operative leg. And when I make them do a single leg squat, I look at their pelvis stability. I look at the high points of their pelvis to see if it's symmetric. And then I watch their knee bend. And as they go down, I watch for femoral adduction, meaning do their knees come closer to touching? And does their hip internally rotate? And consistently, my non-contact ACLs all have really, really weak single leg squats. They have significant strength in their quads and terrible strength in their hamstrings, particularly our female athletes, soccer and basketball players. Yep. And that's a secondary stabilizer of the ACL. So going back to Jerry's thoughts, and Marco, you echo this all the time, is working on the glutes, the hamstrings. Those are crucial muscles. And, a lot of times we spend all of our time as young athletes working on our beach muscles, right? Our biceps, our quads, our chest. We're not worried about the more important muscles, which are in the back. And I think that's a big problem. And I think that's what leads to a lot of these chronic injuries. And the final thing was what Ashish Bedi showed from University of Michigan is when it comes to knee injuries, one of the common causes of knee injuries is a deficient hip internal rotation. So it goes back to mobility. You don't have that hip internal rotation. You have deficits there. You get stuck. You plant, and that allows for that valgus motion or that more strain on ligaments such as the ACL. I think a lot of these chronic injuries are from poor strengthening.
Sure. No, and I agree with you 1,000% on that part. You know, one of the issues that I keep seeing, and I always keep emphasizing, is everything should be about quality, not about quantity. For example, I know Jerry showed some of the plyometrics or the eccentric loading that I think is very important for athletes to do. Every athlete and also every parent wants their kid to have that you know, the faster, stronger, jump higher, and everything. And I see a lot of strength coaches or a lot of trainers work on that, you know, vertical jump. Let's get you jumping. Let's get you jumping. But one thing you got to consider, like Isaac Newton said, what goes up must come down. When you go up, the weight and the forces applying down are a lot higher. So, and majority of injuries, as far as ACL injuries, knee injuries, ankle injuries, occur when you land or when someone bumps you and you land in an awkward position. So emphasizing eccentric landing, like Jerry said, is very important. But also what Dr. Nima said, it's also making sure that when you land, you have the proper mechanics and proper movements. So when you're watching your kids or your athletes, when they're landing, make sure that their knees don't cave in, valgus, or they're not tilting over to other side. It always has to be the pelvic neutral strength. Like Dr. Nima said, glutes are the #1 stabilizers for the knee. You want to make sure you kind of focus on those, not only doing bilateral, but like Jerry said, doing unilateral exercises, because you may have strength on one side more than the other side. And that's what, like Dr. Nima said, you're going to be compensated for one or the other side type of thing. Yeah, so that's a great point on that part. I had like a whole presentation also, but I think that might be a little too long. I don't want to kind of get into that. So in case we have any other questions on there. Is there any more there, Arlene?
No, I didn't see anything else.
Okay. I'm going to try to see if I can share mine. Can I share mine real quick? I have just like a 4-slide.
You're good. There's a question just came in while you're doing that.
Okay.
Do athletes teams buy their own mask, or will the district school provide? I suggest considering purchase for your personal use. I am unsure what funding schools will receive. Yeah, that's a good question.
Yeah, that's for me, because I mean, as somebody who runs and trains and is going to be working with teams, I want to make sure that, you know, it's kind of that personalization, right? Like everyone has their own shoes and socks, and, you know, like I want you to feel safe in the masks, but I also feel like I don't know where the conversation has been. You know, like we're already underfunded for equipment, right? So what about masks? So any athlete who's here, please try and try some out first, right? Make some good recommendations to me so I can advocate and say, hey, our soccer player said this works, right? Our football player says this works. Our tennis players say this works, you know, so I think each sport is dependent as well. So please do some research out there. I mean, I'm trying out different things.
Mrs. Kipe is our principal, for those of you who don't know Mrs. Kipe.
Can you guys see my screen? No.
No.
For some reason, I can't access my computer. Can you make me a host real quick?
Yeah, you're a co-host.
A co-host? So why can't I?
At the bottom, you don't have the green that says share screen, the little green one?
I do, but it just comes up with the whiteboard. Can you guys see now?
I see white.
The whiteboard.
Okay. Now?
Just a whiteboard with a little marker.
Anything? No, right?
No.
All right. See if I. All right. I don't know why I can't do this. Stop sharing. Okay. Anybody else any questions while I figure this out?
So I had a question for, I mean, anyone that can answer. If there's any administrators here, like what's going to be the protocol, or kind of are coaches going to be able to be with their athletes during the school year, not be with their athletes? Is there a time restriction, or how is that going to work?
Yes and no. We're waiting on the negotiations. So the teachers contract and the district have negotiations. And so we know that coaches can practice virtually, which is why this work is so important, like showing here's the types of safe things that you can do. But like in-person practices aren't supposed to be till sometime in December, but it's still not clear. So again, like me talking to Arlene, it's really important. How do we like gradually transition our students to moving? Because some students have been consistent in their workouts, but a vast majority have not been. So it's like what we don't know, we can't control, but we can control healthy eating, healthy exercise, gradual, coming back to moving.
Got it.
There is a question that came up. Do you feel that it is important to just focus on sport-specific training during these times to enhance performance, or working on other skills would also be beneficial? I can kind of start with this, and maybe Jerry, you want to add on to what I think it's really kind of risky for this age group to be only concentrating on one sport. You don't want to have any overuse syndromes. So really working on a lot of things that Jerry covered as well, on overall mobility, vertical stability, so then they can add momentum. Deceleration is huge. I'm seeing a lot of athletes that don't work on deceleration, posterior chain. And just remember, a lot of these students have been sitting in flexion for months. And if practices don't start in December, that's 10 months of inactivity. So a lot of posterior chain. So flexion just means that their muscles in the front, the mirror muscles, are all closed in. So we got to work on getting them extended, standing up straight, posture, to avoid a lot of these injuries. But you got to be careful with being only working on one sport movement. And also when based on CIF schedule, a lot of sports are going to overlap. And a lot of our students play 2 sports. So they may be really going into a lot of overuse issues come December and January when the games actually start.
Correct. And I think that's the other thing, my understanding that I heard or read, that this year they're not going to restrict club teams playing at the same time as the high school team. So if you're an athlete, you're going to be allowed to participate in the high school sport and also in your club team. So now you imagine you have kids that haven't been doing anything for 3-4 months. Now they're going to have a practice from 2:30 or 3 o'clock to 5 with the high school. Then they're going to go probably in the evening to go practice with their club team from 6 to 7, or vice versa. They may have high school games in the weekdays, and then they have their club games on the weekends. So all of a sudden you go from not loading them whatsoever to overloading them whatsoever. The example that I always kind of give when I talk about is if you take a glass of, you take a glass and you have some milk, you eventually want to slowly pour it in, and kind of slowly increase the volume. Because if you're a little kid, and what happens when you dump it in all at once, it splashes and gets all over the place, and that's kind of where injuries occur.
Dr. Nima's going to be busy, man, with all that practicing.
Can I be here for a second? Yeah. For some reason, I can't share my slide, but I'm just going to just talk about I had some pointers here to talk about it. Basically, as far as reducing risk when returning to sports. One, like Jerry said, keep initial practice kind of short. Focus more on endurance stamina, especially if the athletes are kind of out of shape and they haven't been able to do it. Like I said, a lot of times they're going to try to go gung-ho and try to regain it as much as possible. Just like Jerry said, review landing and cutting mechanic movements, especially when it comes to stability. They haven't been doing anything. That's one of the key issues. When they have poor landing mechanics or poor cutting mechanics, that's when you kind of get the injuries. And what's going to be crazy is that you, as a coach, you may have to review individual techniques and skills. The one thing you have to keep in mind is that as these high school athletes, they're maturing, they're changing as they're growing, especially in these 3-4 months. They may have gotten taller, they may have gained weight, they may have lost weight. So now they're moving around prior to this, their mechanics are going to become completely different, and basic skills that they were so used to doing because they haven't done anything, and now their bodies have changed, have grown, gotten taller, gotten shorter, more weight, less weight. Their body has to adapt to those same kind of movements. So you kind of have to be aware of that. And like Jerry said, right off the bat, you want to limit repetitive movement. Because like Dr. Nima said, majority of chronic issues, like anything as far as itis, tendinitis, Achilles tendinitis, any type of tendinitis, is caused by repetitive movements. And when you have somebody that hasn't done that movement right off the bat, and you force them, or you have them expect them to do the same movement over and over and over again, because you're trying to hurry up and get them, kind of get them back in the game or get that skill that they had back then. And obviously, hey, let's go to do as many as we can. Then that's where the issues kind of occur. Now, one of the slides that I had is that when is soreness and pain a concern? It's just some tips that you kind of want to keep an eye on with your athletes or with your kids. I have like a list about 8 of them. One, obviously limping or change in walking pattern should be a concern. If you see your kid, your child, your athlete out there running differently, or the gait's completely different, or they're walking differently, that's a sign, hey, something is going on here. There's a thing called the fingertip pain. Oftentimes, if you take, as an athletic trainer, I always, when I have with athletes, I ask them, hey, can you take your finger and point exactly to where you have pain? Oftentimes, if they can say, hey, it's right here, that's a little bit of a concern versus the athlete say, it's just kind of soreness. It just feels all over the leg, all over the muscle. that's a little bit different. So if your athlete or your kid can take their finger, say it hurts right here in this spot, there's might be an issue where there's a tendinitis, ligament issue, a muscular issue, or a muscle strain because the pain is localized to one area. Obviously, if you see any kind of major bruising or swelling, that should be a major sign of concern. Another one, medication. If your athlete needs to take medication with over-the-counter because they're heavy soreness, that might be a little bit of, okay, why do you need it to be taking medication if you just had a practice, you just had a game, you had a session? That might be something a little bit of red, like, hey, okay, if there's need for medication, obviously there's something going on that part, assuming that it's an injury. If there's pain for several days, if your athlete or your kid's complaining of the same amount of pain 2, 3, 4, 5 days, it hasn't subsided, it's still present, still there, that's another sign of concern as they're returning. Pain or soreness that does not decrease after several days. And then finally, also focusing on a specific body part. And what that means is that if your athlete's out there running and they're so concerned about an ankle, they're so concerned about their hand, they're so concerned about their wrist that they're not using it, that might be another sign that, hey, okay, something's going on there, that it's concerning, that the athlete is going to start getting compensated, and you may want to kind of dive into it a little bit more. What 4 areas that I kind of was suggesting as far as that athletes should be doing now, even before they get in there. And I think Arlene kind of touched about it. Mobility is a thing, one you can go ahead and focus on at home till the cows come home, as they say. Mobility is very important. Focusing on stability and proprioception are the 3 key components that you could do at home. You don't need heavy weights. You can just maybe a little bit of TheraBand, stuff that you can buy, foam rollers, any of that stuff that you can do. And obviously, like Jerry said, endurance and stamina are things that you can definitely be doing at home. You can be definitely going to a track, doing all that stuff. These are the 4 areas: mobility, stability, proprioception, and endurance, stamina are the key components that you should be focusing on as far as being able to establish a foundation for yourself as an athlete. Anything you want to add, Dr. Niemann, to the any signs or symptoms that you may see with athletes or parents?
Yeah, I think what you said is really great. You hit most of the major points, but something that's very easy for this age group that we can kind of talk about or keep an eye on is the importance of actual vitamin D. In the NBA, I did a study a while back, and it was over 70% of the athletes were vitamin D deficient. Okay, and that's saying that they have lower than a 20 on the vitamin D rating. Usually, you want to be above 30. Actually, for musculoskeletal illnesses or problems, you want to be above 40. So people are getting more muscle strains, sprains, etc., fractures when they're below 40. There's some evidence of that, and even more upper respiratory infections when they're below that number. So we want to have a legitimate vitamin D dosage. And what's been shown out of a study from USC was that if you have darker skin tones like myself or darker than I am, you have a 15 to 20 times higher risk of being vitamin D deficient. So the same study I did in the NBA, we did in the NHL, and 96% of the athletes were vitamin D sufficient. And what's the difference? It's purely race. The NHL is almost purely Caucasian athletes. And so the bottom line is it takes 10 times more sunlight to pierce my skin or someone darker than me to get the right amount of vitamin D. So we need to make sure that our high school athletes, our junior high athletes, things like that, they're taking the appropriate amount of vitamin D, they're getting their vitamins, and they're making sure that they're not deficient, especially with our darker skin tones, because then that could be a part of their whole process of having these muscle strains and sprains, et cetera. It's a whole system, right?
Correct. Yeah, it's kind of interesting that you mentioned that, because traditionally when you think of athletes or individuals being vitamin D deficient, it's because lack of sun, or they spend 99% of the time indoors, where basketball players, that's what they do. But same thing, hockey players. Was kind of interesting that that's not necessarily, it may not be the case.
Because it's purely based on our right. Melanin, and the darker your skin, the more sunlight it takes, and that's the problem.
Now, the other interesting part is in the high school level. I don't know, I haven't been in the high school level for a while, but as far as the pre-participation physicals, I imagine that vitamin D deficiency testing or blood testing isn't normally done as a PP, correct?
No.
Yeah.
I do it on all my athletes that I see at a surgical standpoint, but it'd be nice if it was done on these athletes, by their primary care physicians a little bit earlier, especially our darker skin athletes.
Now, what do you? I had a question. I think I might have asked you this already before. Your thoughts on how the pre-participation physical is going to change or should change because of this whole COVID and the sedentary style. I know, like I said, high school physicals, I hate to say this, sometimes aren't really full length, like especially like I said, when I was with the Lakers, a full physical for an athlete would take 3 to 4 days. Like from it's not like, hey, come in for a quick 10-minute check. Okay, you're good to go, ready to go. Let me sign the paperwork. Professional athletes go through a 3 to 4 day process and it's like a full day thing, which is kind of interesting.
Yeah.
So what are your thoughts on what? It's a whole thing. I know we can talk about this in the whole entire thing, but maybe like 1 or 2 things that parents should maybe be looking for when they do go see their physician. Hey, maybe ask this question or ask this other question.
Yeah, it's good. It's a good comment. And the truth is it always comes back to resources, right? It's like our lovely principal had said. The bottom line is it's money. Do we have enough money to have the resources and the time to provide what we actually need to provide? The things that in general in the past, when I do these high school physicals or college physicals, you have 4 or 5 people basically each like targeting an area of the body and having these kids fly through. It's like a 5-minute physical for all of them, and unfortunately things are going to be missed. The most important thing that parents need to do to help us catch the right things is, 1, we really need to know the kids' past medical history and allergies. And they don't do that. Kids don't know or even remember or recognize what they've had. So a parent needs to fill that out and be like, it's super important that you tell them that you have asthma. It's super important that you tell them that you've had chest pain or an EKG 4 years ago because we were worried about a heart issue. Because now all of a sudden I'm listening to that heart, although I have no business listening to a heart, but I would be listening to that heart a lot longer, right? Point being is that they need to help us. Every human being needs to be their biggest advocate. And then 2, it comes down to the systems. The most important thing goes back to ABCs in any part of medicine, or it's ABCs, right? Airway, breathing, circulation. We want to make sure that, do they have any issues when they're playing sports? Do they ever get any issues with breathing? Do they ever get any issues with chest pain? Do they have an irregular heartbeat? These are all the things that are the bigger things. Your knee pain, your ankle pain, those are a smaller deal that, our athletic trainers are excellent and spend a ton of time with you, and they're going to pick that up. But we want to catch these kids who have, hypertrophic cardiomyopathy, right? These kids who are 7 feet or, super tall, and then they die on the court because they have a heart attack because their heart's too large. We want to catch these kids from having heat strokes. So those are asthma attacks. Those are the kids, because that can affect their life drastically. The minor knee pain, things like that. All of us, Jerry, you, Juan down there, Arlene, we're all going to pick up on this stuff through time, but we want to catch the big things.
No, and I agree with you. I think as far as the parents also being the advocate and going with their kids, or at least being present there, because I know that there's been some places where I've been to where the parents show up and then the kid kind of goes into the room with the physician, or like open space, or like a little area over there. They do the physical, they come out. The parents like, hey, how'd you do? Oh, signed it. All right, let's get out of here, type of thing. You want to go with your child. You want to make sure you impress and make sure you ask as many questions as you can. And it's kind of funny that you say that, because my daughter was filling out her PPE or participation the other day, and she's like, Dad, have you ever had a knee issue? Dad, I'm like, what do you mean? It's your body. It's just like, again, you remember that time you did that? It's like, oh yeah, that's right. And she's like, Dad, have you ever had a concussion? I'm like, it was like surprising to me that, I'm like, hey, like, you should know all this. But you're right. In reality, kids sometimes they forget, or they don't know it, or sometimes they just don't want to speak up. They're just embarrassed to be there. Just want to get this in, kind of get it. They're going through the teenage years. So just want to get in and get out. I want to go home. I feel weird. I feel awkward here, type of thing. So it's always great for the parent to be there, advocate, bring up stuff. And it's always good to maybe either take notes prior to you going and have something ready to go. Because like you said, Dr. Nima, one of the biggest indicators for injury is previous history of injury. If you've had ankle sprains before, you're more likely at higher risk of having an ankle sprain. So that's something that the physician may want to look at, check your ligaments, or anything of that sort. So it's always very smart to bring up any and all previous injuries. I know a lot of times, sometimes parents are concerned, but hey, because if I bring up something, will the doctor fail my son or daughter? Will they fail on their physical? And it's not necessarily you want to fail. It's that we're trying to find out what's going on, how high a risk of injury, and it's all about preventative type of thing.
And I do want to add to that what I've seen in the classrooms. A lot of athletes are afraid to disclose pain or injuries because they don't want to be pulled off the field.
Correct.
And a lot of them are so used to pain that they feel it's normal. And they feel like, oh, it's just part of the workout, or it's just part of the sport. But then when the pain doesn't go away, it's gone so long that now it becomes more of a permanent damage, or, you know, it could change the trajectory of a player. What if this player has a Division I, you know, prospect, but then they get injured due to, you know, basically just, they could have just maybe done their training a little differently. So it's really kind of concerning what I see a lot in the schools. Dr. Nima, I wanted to ask you, is there a concern for students that are still growing? I mean, I know some kids like grew a few inches in this last few months and then having to return to sport from doing nothing. I mean, what kind of things should they be looking at?
The biggest problem is, it's a great question. The biggest problem with people who are growing, or they're growing too fast, is they're not used to their body. And as a result, they are clumsier. They're not as strong. They're not used to carrying the weight. They're not used to the difference of center of gravity. They're way more injury prone. This is without data. This is just anecdotal, in my opinion. Just even seeing my friends who grew up and had a 5 or 6 inch growth spurt, and they went from a point guard to a power forward. My God, they were just different. It was a different situation for a while for them. So yeah, I think that's a great question. The only things that they can do is just work on, as Jerry and Marco had said, work on their strength, work on their mechanics, and the biggest thing that everyone can do is don't go 0 to 60. Take your time. It's a gradual progression.
Yeah, and you know, it's kind of, that's a good point that you bring about. It's kind of interesting how maybe even when you start playing and the coaches are out there, it's almost like you, as coaches, you may have to do a whole reassessment of your athletes when they come out there. Just assume because you have your starting wide receiver, he is ready to kind of go because that's what you had last season. You may have to do like a whole entire trial and reassess your athletes and see where they're at. So like Nima said, like Arlene said, over these last 3-4 months, they've changed, they've grown. They've perhaps gained weight. They maybe have lost weight because they're not eating properly because they're stressed, or maybe might have gotten a little depressed type of thing. So any of these changes that have occurred will change their mechanics, and they will change their kind of create them clumsiness, like Dr. Nima said. So as coaches, even as parents, it may be something that you have to kind of reassess your athlete and almost do a whole entire new tryout, so to speak, and see where they're at. You know, is my defensive lineman still capable to perform like he did before? My volleyball player, my setter, she's able to do the same thing, stuff like that. So it's kind of interesting that you have to almost, you know, imagine that you have, you know, no season last year, all new players. Let's start from scratch. Let's reassess everybody, see where they're at.
I had a question for Dr. Nima. As far as like when it comes to like ACL tears and pretty nasty injuries, can you maybe talk a little bit about the differences between men and females and males? As far as typically, I'm assuming that women are probably going to be doing, you know, during this time more of their sport. They might be, you know, playing some soccer, some pickup. Guys might be doing some push-ups, some squats. But can you maybe touch base as far as one, kind of the differences that you see between females and males, and why, you know, it might be really important for females to do some type of, even if it's just body weight, but some type of strength, power development to reduce kind of injuries?
Yeah, that's a great question. The number one thing that comes up for the difference, for the gender difference, is ACL tears. ACL tears are about 5 times more prevalent in women than men. So if we want to really get the most, you know, bang for our buck, let's invest in all of our female athletes, because they're going to have the quickest growth and the fastest way to decrease that rate. There are so many studies that show that if you do the proper, you know, strengthening programs, landing mechanics, mobility, that you can actually cut down ACL tears significantly for non-contact injuries, obviously. And so if we invest in our lady athletes, if we invest in them the way we invest in our male athletes, we are going to make a drastic difference on the number of injuries that we have. And it goes back to what you and Marco said earlier. It's all about the mechanics and the strengthening. The number one reason, in my opinion, there's also anatomy, right? Because females have wider pelvises and a narrow notch. The notch is where the ACL and the PCL are anatomically, and it's been shown that those two things can have a higher effect on ACL tears. They also have a wider Q angle. Their feet go out further. They're more in that valgus position that people talk about. Whether or not it's 100% true that causes it, that may play a role. But the number one thing, in my opinion, is women. The difference between that quad hamstring ratio in a woman compared to a man is drastic. You look at women's soccer players and basketball players, a lot of times they do land in valgus, but more importantly, their quads are strong and their hamstrings are non-existent. And so the hamstrings pulling that shin bone, that tibia back, preventing that ACL tear, it's a secondary stabilizer while the quad's just yanking it forward. And so the girls really need to work on that posterior chain more than anyone. The other injury that's common in women, that's a little bit, it's not as much in my zone, but a little bit, is concussions. Women athletes have a much higher rate of concussions, particularly in soccer, compared to men in soccer and basketball. Now, obviously, there's American football, take that out. But when it comes to soccer and basketball, our girl athletes get more concussions than our boy athletes. So that's a lot about, that's just coaching and training. Why are they having so many more head collisions in the same sport, right? So I think if we invest more in our female athletes, we will drive the number of injuries down significantly. And unfortunately, until recent years, we haven't done a good job of investing in our female athletes, and that's changing. And I'm really happy to see that change.
Thank you for that, Doc.
Hey, Dr. Quick question. Regarding the ACL ratio type thing, obviously my understanding, everything that I've read, you want it at a minimum, and this is like minimum 60% quad to hamstring ratio. You want to be more at the 80% type thing. Is it different? Should it be different for females?
I honestly don't know the answer to that. I think the most important thing is I think of it as it's a dynamic stabilizer, your muscles, right? So I want to know that if my quad is yanking my shin bone forward because of an acceleration or deceleration play, my hamstring is symmetrically, antagonizing that. So you have your agonist and antagonist, and just making sure that's pulling back so I don't yanking too far forward and tear that ACL. I don't have a good answer to that. I wish I did. Maybe it's a good study.
You're right. Yeah. Next one. Okay. What time? What do we got? We got about maybe 5 more minutes. Any last questions, or anybody? Does any parent maybe have any specific questions about their kids' previous any injuries that they've had, any previous history that they want to ask myself, Arlene, Jerry, or Dr. Nima? Feel free to unmute and either chime in.
Here's a question. What are some exercises to support hamstring? Is that hamstring, Eileen?
Yeah,
quad. Okay. Hamstring, quad, shin development, or calf development.
Oh, how to support strong quad, hamstring, shin development. Yeah.
So to me, like the go-to for me with hamstrings, and it's, pretty backed up in the literature, is going to be Nordic hamstring curls. And the cool part is you don't need equipment. Either you have a partner holding your, you can just type in Nordic hamstring curls. The key thing though, these are difficult. Okay. So these can be regressed in a way where you can just have an athlete hold a position. You can tie a band around their chest to give them a little bit of a relief going down as far as taking some tension away. But the research is pretty clear that that one exercise can reduce hamstring injuries if they're doing that, once or twice a week. It doesn't have to be a ton of reps. On the other point is it's going to get you really sore because those things it's basically all eccentrically loaded. So I would say for hamstrings, Nordic hamstring curls, RDLs are great, single leg, double leg, and deadlifts. I would say those are kind of my great bang for your bucks is deadlift, Romanian deadlifts, and Nordic hamstrings for me.
No, I agree with you with the Nordic hamstrings. There's plenty of literature out there that has stated about Nordic hamstring would try to help reduce hamstring injuries or strengthen as well. I know there's another one out there that I tend to use very similar to the Nordic hamstring, where the athlete is prone. You put a Swiss ball kind of like on their buttocks or on their back, and they have to kind of pretty much flex it up, and so you're getting that kind of concentric, eccentric, that speed motion going over there, try to kind of help reduce it too. I like doing those as well.
Nice.
There's a question about rolling from Sean. So Sean is one of my sports med students. I think you're talking about myofascial release. You suggest rolling. Is that what you're asking, Sean? Foam rolling?
Oh, yeah. So I'm guessing as far as foam rolling to help reduce myofascial release, whether you want to do lower extremity, you can get a cheap foam roller on Amazon for about $10-15. You can go online. I have like a whole array of exercises, I think already in a sheet. If you want to shoot me a text or Instagram, I'll be happy to send it to you. But foam rolling, now one of the key things is that when you do foam rolling, make sure you do foam rolling prior to do any type of flexibility or stretching, because you want to kind of reproduce that. It's very beneficial to do the foam rolling first and then do the flexibility. Foam rolling is also beneficial for as far as recovery. There's a lot of devices out there nowadays. If you want to get it more down, you have the hypervolts. If you want to kind of get more into percussion units type of thing, but foam rolling is a standard thing that I think all athletes should probably have at their home. And like I said, it's very cheap on Amazon. You can get it for about $10, $10, $15.
Next question.
There was a question for Dr. Nima, can small fingers and toe fractures turn into chronic injuries?
Oh yeah, that's a really, really good question. It's actually more about, so there's certain types of finger fractures where the joint is kind of destroyed and it leads to deformity, such as a boutonniere deformity or a swan neck deformity.
Mm-hmm.
You can look at those up on Google and see the pictures. But basically, the ligaments around the finger drop either in front of or behind, and it causes your finger to like become like this or like that. And that's a problem. Those can be serious chronic problems that really can't even truly be fixed, because you'd be trading a better position for possible pain, or it's just there's not a good surgical fix. So the most important thing is when you have an injury and you have a finger injury, to actually get an x-ray, believe it or not. Because a lot of times you think that it's just a jammed finger, and I made that mistake. And then you end up having these major finger deformities when all it needed was to be splinted for a few weeks. So that the best thing I can say about fingers, and not as much toes usually aren't that big of a deal, but fingers particularly, it's really important. If you think that an athlete has a jammed finger and it's just a swollen finger and it's something basic, just get an x-ray, make sure there's no fracture, because if it's in the wrong place, it could drastically affect them.
Yeah, I agree with you. I mean, there's sometimes you have like either a avulsion fracture type of thing that you may not necessarily be able to do a surgery on it, but if you splint it, it will eventually kind of heal and calcify, and then you should be ready to go type of thing. Or if you leave it alone, like you mentioned, it may build some arthritis or some other issues there. What time do we got? I know. Okay, we got about 3 more minutes. Maybe we'll just do one more question. What are the best exercises for ankle stability for home exercises? Actually, I had a whole presentation on that, but we'll go. But bottom line, if you want to just do something very basic at home where you just do kind of what we refer to as balancing on one ankle type of thing, you can start with something basic as far as that. But at the same time, one thing I want to also emphasize is you want to do eccentric landing stabilization with your ankle. Is not just kind of just standing there. So, what I tell everybody, if everybody either, you live at home, there's probably a curve, you probably have a step, and just be able to kind of step down the step and land on one ankle and be able to kind of hold it and kind of stabilize. Either just balancing with one leg, balancing with eyes open. The other plan I tell everybody, find a wall, get a tennis ball, and you just juggle against a tennis ball as you're balancing on one leg. If you don't have a balance pad at home, like an Airex, you can get like a towel, fold the towel in a couple patterns, and that'll create a little bit of an imbalance for your ankle. You can start with some basic stuff like that at home. Okay. 12:58, I think we're going to go ahead and wrap up. I want to thank everybody that participated here in the webinar, especially Arlene, Jerry, and Dr. Nima. Thank you very much for your time, taking this time out of your day. I appreciate all of you guys. They're all great friends of mine. I've known them for several years already. I've always valued their opinion. I always call them for advice, especially Dr. Nima for any medical ortho, second opinion type of thing. And I think, Arlene, you recorded this, so if you guys want to reach out to Arlene, if you guys want to copy this,